muted. We're good to go. So let me just say, and I apologize for having to repeat this, but so we're here at the OCDE EIS system. That's the slide that we're looking at. And this is where you're going to want to register for the EIS system. So this is where you would view your paycheck stub, your W-2, and your vacation and sick leave and PN balances. The website, if you've never logged on before, is down in the bottom right, or excuse me, left-hand corner. You want to enter an email address. We recommend a personal email address, but you're free to use an FSD email address. If for some reason later on you left the district, you would have to re-register with your personal email. You would go ahead and create a password. It gives you, what you need to actually create your password as far as characters, numbers, and so on. You will use your 10-digit ID to sign in. And your 10-digit ID is basically 22 4 zeros followed by your FSD ID. That's your 4-digit ID that you enter on your timesheet each month. All right. So go ahead and get set up with that. We do recommend it. It's a great tool. Okay, let's see why it's not going. Did this. Okay, thank you. So when you do log into the EIS system, these are some of the things that you're able to look at there. Your balances, you can see that year at a glance, month at a glance, balance detail. Your online pay stub, that's great. So if you ever have any questions, it's best to start there before you reach out to payroll. That way you can see, what is specifically on each individual's paycheck, meaning your regular hours, any extra overtime, your deductions, and so on. So that's a really good thing. I'm on it myself all the time. So tax forms, you can view your W-2s when they're available. And like I said, online pay stubs, your vacation balances, year at a glance, month at a glance, and balance detail. That's a great thing to see where you're at as far as your vacation, sick leave balances, and so on. Okay, this is just what it looks like. You can see all the pretty colors that we have for vacation, sick leave, what else? Family care leave in the pretty pink, and sick leave in blue. So this is just looking at someone's actual balances. You can see where they began, meaning they rolled over 8 hours. They earned 96 hours. We're looking at the top one where it says sick. How much has taken? So that's 46 hours and 15 minutes. And their ending balance. So this is a year at a glance, and you can see the years 2016-17. So, but that gives you an idea of, what you're looking at: beginning, earned, taken, and ending. So this is actually the detail. So that was year at a glance, and this is great to look at because you can see how much you have taken. But if you want to know without looking at all the little colors and everything, and it doesn't really give you what is listed in regard to number of hours, you want to look here so you can actually see, hey, sick leave, I took 8 hours on September the 2nd. Vacation, 8 hours on July the 25th. So this is great to have all of the detail here. Okay, now we're going to look at understanding your paycheck stub. So this is the top portion of your paycheck stub where it shows your filing status. This person is set up for direct deposit. You can see this is the pay period ending recently, 12/31/22. The issue date is the 10th. Okay, they're set up as married. Filing status, exemptions 1. And hopefully on the next one, you can get a little bit more detail. There we go. So this is a monthly employee, and speaking of taxes, the most important thing as far as taxes is keeping an eye on your calendar year-to-date totals. This is the first month, so they're going to be the same current amount and year-to-date because it's for the current pay period. So, but going forward, always look at your year-to-date totals to make sure that you're withholding enough or not too much. So keep an eye on that. You don't want to be surprised come April and you have not had enough withheld. It's much easier to deduct each pay period than to come up with thousands of dollars in April. So do keep an eye on that. That's super important. You can come in and make the changes in payroll at any time. All right. So maybe compare it to last year, see where you're at, if you're on track as far as total number year-to-date withholding. So do keep an eye on that. That's very important. You can see, like I said, this is a monthly employee. This is the monthly pay rate. Overtime, you can see underneath all the tax deductions, you can see your pre-tax retirement. So the current is $406.71 if you look under the tax deductions, and then there's pre-tax retirement. So that is the amount that is being deducted for PERS. Pre-tax deduction, this employee has a 403B, so this is also a pre-tax deduction. Employee benefit, so this is the medical insurance, their portion that they are responsible for, the $75. So again, that's a pre-tax item for a total of $1,575. So this reduces your taxable earnings. So this reduces the gross amount by this. Okay, so that is not taxed. And then other deductions, you can see the employee has ReliaStar, American Fidelity. There are CSEA dues, yay, CSEA, state CSEA dues, and Victory Club. And then at the bottom, you can just see the breakdown, gross pay, which matches this figure here. Okay, pre-tax deductions, which we talked about right here. And then this is the pre-tax retirement, which is here. And then the other deductions, which are all of these other deductions. Okay. Total tax deductions. Okay. And then ESA, this is your mid-month or your gross salary advance. So in this case, this employee, her advance that she receives is $1,900. So this amount is with the taxes that are associated with the $1,900. So you'll have your gross pay, less all of your deductions, less your advance, plus the taxes on the $1,900. And this is what this employee received on the 10th. So if you have any questions, please reach out at the end and we can talk about those. Okay, so here is a part-time employee. Okay, they are a part-time monthly employee, meaning they are greater than 50%, excuse me. The previous employee was a full-time employee, 12-month employee. All right, so you can see the monthly salary here. Okay, this is extra time. And then you can see the overtime rate here is a half an hour. And then level pay. So level pay are for those employees that are less than 10 months and that have the 3 days unpaid during Thanksgiving. We split that out among the different pay periods till the end of the year so that you're not hit with 3 days deducted all at once. So it's kind of nice. They started that not too long ago. So that's a great thing to have. I believe it was over 9 pay periods that we split that out. I'd have to go back and look, but you can give us a call and we can go over that. So it does help you so that, like I said, you're not hit with 3 days all at once. Same type of thing, federal, state, OSDI, Medicare, your pre-tax. This is the amount for PERS. And we don't have the bottom portion of this. We just wanted to give you an idea of what it looked like here as far as, I think I need to go back to the previous one. Oops, go back. how do I go back? Oh, here we go. So yeah, so this is, I clicked too far. I apologize. So this was for the monthly employee. And then the next one is 9.5 months. That is less than 50%. So you can see the hourly rate here. Okay. And your overtime rate. These are the number of units. Okay. And your total earnings. Same thing. Your taxes here. This is your retirement portion, your pre-tax retirement. So it's pretty much the same as far as taxes and so on and pre-tax. The only thing that's different is, of course, how it's broken out here. Your 9.5 month employees that are less than 50%, you'll see their hourly here. This is, of course, is the overtime rate. This one is a monthly employee working less than 12 months. You can see their monthly, any extra and overtime they've worked. And then this one is a 12-month full-time employee. Okay, monthly and overtime. So if you are a monthly employee, you are, I know I'm going a little outside of it, but you are paid not by the timesheet, but by your salary. So when we receive your timesheet, the only thing that we do with it is enter any extra or overtime and record any time off. All right. If you're an hourly employee, that's an employee that pays that fills out the white timesheet, you are actually paid by the timesheet. All right. Good morning. We're just updating some information that we've previously provided with payroll information. So we have had some changes in our payroll technicians. So we wanted to let you know who your payroll technicians are now. So Anjali Shabazz, that would be me. I handle certificated or process certificated A through the letter I, classified A through F. Diana Benegas, she is actually a new payroll technician in our department, and she handles all of our subs, both classified and certificated. And she also handles classified employees G through H. Alita Bravo, certificated employees J through Q, and classified employees I through Q. Jasmine Valtierra handles all employees R through Z, and all management, both classified and certificated. Thank you so much, and please reach out to any of us with any questions that you may have. Thank you. Okay. Does anyone have any questions?
Okay, so the question is, I just noticed that I didn't pay any amount to federal, state, or state disability insurance. Do you have any idea why? By the way, I'm a 9.5 month employee.
Hi, Catherine. Great question. So I don't know what your withholdings are set as, but perhaps you did not reach the threshold to withhold taxes. So that's a really good thing that you're aware of that, especially now at the beginning of the year. A lot of times, if you don't meet the threshold to withhold, you can either come in and change your taxes so that you will have something withheld, and we can do a tax projection on that. Or you can also just set it up with a specific amount that you want deducted out of your paycheck each month. All right, so come into the payroll department. We can, you can fill out the new forms there, and we can get a look at, take a look at it and do a tax projection and see if it's where you should be. Okay, it's probably that you don't meet the threshold to withhold. Great question, and thanks for looking. Any other questions? Oh, hi, Catherine again. So your ESA gross advance, that's your mid-month advance that you receive on the 25th, earned salary advance. So like I was saying in the example that we had before, that person receives $1,900 on the 25th, but there are also taxes associated with that $1,900. The IRS wants our money as soon as we're paid. So if you look on your paycheck stub right next to the net pay, you'll see ESA, earned salary advance, also known as a mid-month. So say, for an example, if you were to get $100, you're going to see 100 plus the taxes that are going to be subtracted, okay, from your 10th check. So that's earned salary advance or your mid-month advance. Thank you, Catherine. So someone had a question about why did she just start having retirement deductions? So assuming, again, I'd have to pull up your paperwork, but if you increased your hours from say 3.75 to 4, that is a PERSable position. So you would automatically go into PERS. Or if you qualified for 1,000 hours, you would automatically go into PERS, and that we're notified from the county. Okay. So yeah, give us a call and we can let you know, give your payroll technician a call so we can let you know why there was a change in that. But typically it's because you had an increase in hours. You went from part-time to what's considered a monthly employee. You fill out a new timesheet, buff colored, you're 4 more hours a day. Okay, thank you. Well, thank you so much. And please reach out to us with any questions. We're there 8 to 4:30. We ask that if you need to fill out new tax forms, you should probably come in the office just because of confidentiality with being your Social Security number. So yeah, we would like for you to come in rather than send it. Definitely do not send it via email. If you want to send it through the district office mail, if you have any changes, just make sure you seal it in an envelope, tape it shut, but it's probably best to come in. All right, and give us a call or email us with any questions. Thank you so much.
Okay, thank you, Angelique, for that. That was always great to be able to know how to log into that system because I do check it often too. Let's see, Angelique, I think you have to stop sharing your screen. Perfect. Okay. So I am Jenny Morgan. I work in the benefits department. I'm the benefits technician. Here, I'm going to go ahead and share my screen. Thank you. Let's see, I showed the wrong screen. This is the district website. I was going to take you over that, but let's see. Oh, no. Sorry about this. This is Angela and my first time doing Zoom. So here we go, running a Zoom, I should say. So, okay, here we go. Benefits district. Department, I should say. So Andrea Lopez, she is a benefits coordinator. She is actually out on maternity leave, taking care of her little baby. And so it is me over here, the benefits technician, to help you out today. I have listed our phone numbers and our emails, and we will get into this here. So these are the ways to contact us. Okay, so here, am I eligible for benefits? This is the biggest question I get from employees. We have them divided into 2 different sections. We have those that work less than 20 hours per week or are under 50% FTE. This is based on your contracted hours that you have contracted with HR with. This is not any additional hours if you're working out of class doing any additional hours that way. It is only based on what you're contracted to do with HR. And then the other is anybody working over 20 hours or more, or 50% FTE or more. So if you're under 20 hours, this is what you are qualified and eligible for. We do have one medical plan. It is called the Bronze Medical Plan. It is a high deductible HSA plan. It has a very high deductible, so you do have to pay in full for most of your activities at the doctor's office and such before it kicks in. If this is something that you are looking to and you need, I highly suggest Covered California to explore their plan options there also. There is no dental or vision plan available for these employees here through the district. That medical plan is the only one we have to offer. You do have access to our EAP program through Anthem Blue Cross. I will go over that more in detail later. And then you are also eligible for the disability insurance later. And I will go through that side later. So if you're 20 or more employee, 24 hours or more employee, or 50% or more, you are eligible for district sponsored insurance. And I will go over what all that entails. Also, your contributions are based on your FTE percent that you are working, and then also what plan you are selecting. You are also eligible for the EAP program and disability insurance. Okay, the other question I get is, when can I make changes? Our annual open enrollment time is typically over the summer. We mail out information with your welcome back letter, and it goes out usually the end of July. The open enrollment period, we'll figure out the exact dates, but it's typically the first 2 weeks in August. And any of those changes you make during that time will go active October 1st. The only other time you can make changes outside of this open enrollment period is one of these qualifying events. So if you have a baby, or if you do an adoption or get married, you are able to add them to your insurance. If you do go through a divorce and with the finalized court documents, you are able to remove your spouse from your insurance. If you lose coverage elsewhere, you're able to enroll here. If your dependents lose coverage elsewhere, like if they lost a job, any of that, they are eligible to enroll here. And vice versa. If you gain coverage elsewhere, you are able to cancel your coverage here. Or if your dependents were then to get a new job and are covered for insurance, then you can remove them here at that time. All these changes must be made within 31 days of the event to qualify for the change. Otherwise, you will have to wait till open enrollment.
The benefit spring events for 2024 are as follows. The health fair will return on Wednesday, April 10th, 11 a.m. to 4 p.m. in the District Quad. Over 15 vendors in attendance. Biometric screenings will return to the District Boardroom Wednesday, April 10th, 2024, and Wednesday, April 24th, 2024. Times to be determined. Watch your email for more information on both of these events.
We also do flu shots every year. So we typically do this in October. We pick 3 Wednesdays. We pick 3 different sites. So the last several years, we've done the district office one Wednesday, Parks Junior High another Wednesday, and then Beechwood another Wednesday. This is available to all employees. Again, this doesn't have to be, you don't have to be enrolled in our insurance or anything. So all employees, substitutes, retirees, and dependents are welcome also. I just want to mention that they do not bring any flu shots that are specific to children under 5, or there is a specific one for adults over 65. They do not bring either of those. If you are on our Blue Shield health plan and you missed our flu shot clinic, or would like to go elsewhere, at Costco, you can go there for free to get your flu shot, but that is only if you are enrolled in our Blue Shield medical plan. Disability insurance. This is not offered through the district. And I just want to preference that everybody who works in a district or in our school district does not qualify for state disability insurance because they do not pay into state disability insurance. This is an outside vendors that you can pay into, and that will pay you back if you ever go on like medical leave or anything like that and need supplemental pay for that. We do not process any of this information. I know very little. I can hardly answer any questions for it. So if you have any questions, please contact them directly. We have the standard, which is the FIDA preferred vendor. So this is for teachers, and there's the contact information there. We also have American Fidelity. This is the CSCA, and the FESMA preferred vendors, which is classified and management, and their contract information there. EAP. So this is the Employee Assistance Program. This is eligible, again, to everybody. Anybody who works for the district and including dependents can even access this. So you, this is including subs, this is anybody, everybody that works for the district. The main thing here is there are counseling visits. You can get up to 6 visits per issue, which can be in person, online. Either one. There is also legal help, financial consultations, emotional well-being resources. There are so many things on here that you can go on and access. And the website is there in the blue box. And then your company code is SISC, SISC. And what SISC is it's our medical processor. They are the one who we get our insurance through. It's Self-Insured Schools of California. So it's a group of us, we go together, and so all of our medical insurances are self-insured through SISC, and this is how we get better rates. That's why you use that company code SISC and not Fullerton School District. Again, I just wanted to highlight this is something here too. We know a lot of people are struggling, especially after COVID and losing jobs, any of this stuff. If you need help, if you need to reach out, you need somebody to talk to, please get help. Again, down here in the bottom left, there is the EAP program, phone number there. You can have in-person virtual therapy. If you have Blue Shield, you can contact them directly to find somebody. You also have access to MD Live and the Vita app, which I will go over more too, but they are there for help. So, and Kaiser, you just need to call them directly to schedule any appointment. So please, if you need help, please, please, please search help. Okay, so do we have any questions for this as of yet? Elizabeth, I'm not sure if you can hear me, if you're able to read any questions. Can you see if there's any questions on there, Anjali? Oh yeah, there's a chat. I'll go further down.
Jenny, can you hear me?
Oh yes, Elizabeth.
Yes, it looks like we don't have any questions right now.
Okay. Okay, so moving forward, we are going to move into those that, this is geared more to those who are working 20 hours or more and qualify for district-sponsored benefits. What are district-sponsored benefits? We offer medical, dental, vision, flexible spending, and life insurance. So for medical plans here, you can see we offer quite a few. We have 7 medical plans that we offer to choose from. Now, again, these are anybody that's 20 hours or more, 50% or more. And I have a chart that I will show you towards the end that shows you how much your actual contribution is based on your FTE percentage. Dental plans, we have 2 to choose from. We just have a dental PPO or an HMO, and that's it. Kaiser, vision, we only have VSP plans. Kaiser does include vision through Kaiser. So VSP is an additional option. I'll talk about that in a second here too. For flexible spending account, there is a healthcare FSA and a dependent care FSA. And for life insurance, there is the basic life insurance that you get that's paid for by the district, and there is additional voluntary life insurance that is employee paid. I am not going to go into much detail about what the actual plans cover because we don't have time for that. So if you do have any questions specifically on plans, you can just come see me, call me, email me, any of that. I will more than willing to help you out. I'm just going to highlight something here with, oops, went too far. Kaiser. Okay, so I just want to bring this up because this is new this year. So 10/1/23, we are now offering an additional Kaiser plan that has a $30 copay. So that is our Kaiser 30. Our Kaiser 15 has a $15 copay. Our Kaiser 30 now has a $30 copay. They both have no inpatient hospitalization still, and the copay for prescriptions is slightly different. If you have questions on that, contact me, or I can show you where to find it on the website. And you can look at that there. We did that. We brought that in because the cost of Kaiser went up dramatically this year for the family plan. So that's the main reason we try to bring this in, to offer another additional option to have it a little bit less. I just want to touch on the vision again for Kaiser, that you have vision included through Kaiser, and that if you would like to enroll in VSP, this is in addition to your vision coverage. You are able to still use your vision coverage through Kaiser if you enroll in this VSP. So the cost is $27 per month for that. The district does not pay anything towards that. We just allow you to enroll in the plan. So you have two separate vision plans. You can get, since you can only get frames every other year, you can get frames 1 year through Kaiser. You can get the next year, you can get it through VSP, or you can use contacts. You can get glasses on one, contacts on the other, but it is two separate plans. The $27 per month is a composite plan, which means whether you have 1 or 10 people on the plan, it's all the same price. PPO plan. This is something that I always want to mention because this is so important. If you have the PPO plan, for these 5 procedures, you must go to an ambulatory center. So it's orthoscopy, it's cataract surgery, it's colonoscopy, it's upper GI with or without biopsy. This is very, very important. This is a change that happened several years ago. And what they're doing is they're trying to keep costs down overall. So instead of going to an outpatient hospital facility, which costs the insurance company still a lot of money because you're still in a hospital setting, they want you to go to these ambulatory centers. These are centers that are specifically set up for these. It is outside of a hospital, so they don't charge the hospital rates. The amounts that are listed here is the max that they will pay if you go to an outpatient hospital facility. So if you do a colonoscopy at like an outpatient hospital facility, then you will be charged what's beyond your maximum benefit. We have heard of people contacting us and telling us that they've had to pay $3,000 in addition to what their normal deductions are because they went to a hospital facility. If you go to the ambulatory center, you will only be responsible for your regular deductible and coinsurance amounts on your plan. Okay, now we're going to talk about flexible spending. What is it and why do people want to use this? So FSA is where you pull money out aside out of your paycheck, and this is all done pre-tax. The benefit is that it reduces your taxable income, so you pay less taxes on your paycheck that Angelique had gone over and showed us. The plan year is from 10/1 through 9/30. That is what our plan year is at the district, and we so the money must be spent during that plan year. If you want to do this, you must enroll every year at open enrollment. So you have to fill out a new paperwork with whatever dollar amount you want for that plan year. Every year we have to re-enroll. So there's 2 different ones. There's a healthcare one, which can be used for medical, dental, and vision items. This is co-pays, this is doctor visits, this is co-insurance, this is for dental, let's see, it can be for any of your co-insurance, it can be for braces, for vision, it can be glasses, it can be contacts, contact solution. Right now, they're including over-the-counter medication. This was in response to COVID. So Tylenol, ibuprofen, a lot of these things are all included right now. There's that bottom website down there that has a link to everything, and it's searchable. So you can type something in and it'll tell you whether it's approved for the FSA or not. We do have a rollover amount on this plan. It has to be whatever you have left at the end of the year, as long as it's above $50 and below $500, that amount will roll over. Your annual max that you can enroll in is 2,850. That was the max from the 10-1 plan year. Every year, the IRS increases this limit slightly. So we shall see what this year's limit can be. Now, if you have two, like if you and your spouse both either work here or have an option to enroll in this is something you both can max out the 2,850 out of your paycheck. We divide that up into 10 months and it's deducted monthly out of the 10 paychecks. Dependent care. This is used for childcare expenses for children, your dependents under age 13. The annual maximum that you can use for this is $5,000 per household. So if you and your spouse both have options to this, you are not eligible to go over the $5,000 per household. And this, no rollover is allowed. Absolutely none. So you want to make sure it is very specific to what you use. Also, the difference between the healthcare and the dependent care, healthcare, whatever you elect, is front loaded and available once your enrollment starts. Dependent care is only available as the money is deposited from your paycheck into the online system. Life insurance. District paid life insurance. We get basic and AD&D, which is accidental death and dismemberment. Employee benefit amount, you get $100,000 for yourself, for spouse and domestic partners. Your benefit amount is $1,500, and for children, the benefit amount is up to $1,500 also. For voluntary, and this is what everybody gets. Everybody gets this as long as you're over the 50% FTE. You waive all your other benefits. You don't enroll medical, dental, and vision. You still get this district life insurance. So it is very important. I made a note down here at the bottom. Please make sure your beneficiary is updated. If you do not know who it is, you can fill out a new form and send it in. Because we have people who have life changes, they get married, they get divorced, and they never update their life insurance. So you want to make sure that that's updated for you. Voluntary. We do offer voluntary life insurance. This is a group policy plan. This is all employee paid. Employees and spouses can enroll between 10,000 and 500,000. I missed the K on that one. And children can enroll in up to 10,000. You can see below on the charts, the children one is actually pretty cheap. So you can see the range there. So for the most is 10,000. It's $1.72 per month, and that is per child. Not the cost is per child, the coverage is per child. So the $1.72 would cover you for however many children you have. The employee and spouse rates are based on the employee's age, and that is what it's based on. So let's say if you're 30, the cost is 95 cents per 10,000. So if you wanted 100,000 in addition, it would be $9.50. Whatever you enroll in voluntary, it is in addition to the basic and AD&D that the district pays for. Okay, these are all additional benefits that come with having different plans, and I'll kind of go over them here. So the first one again is the EAP, available to every employee. This you can do counseling, there's financial help, there's all that different stuff. Their contact information is there to the right. The next one is the expert medical opinion. This is through Teladoc, and this is for anybody who's enrolled in a medical plan through us. So this is either Blue Shield or Kaiser. So what you can do is you can get a second opinion. Say you got a diagnosis and you want to make sure that that's the right diagnosis, or you want to make sure that the right treatment plan is what they're doing. You can contact them and have a second opinion done from them. The following three are for Blue Shield enrollees. You have to be enrolled through a Blue Shield plan. That could be PPO or HMO through the district here. You are able to access MD Live, which is virtual doctor's appointments. You can do behavioral health or any of that. The sign up is over there to the right. Costco offers free generic medication for our Blue Shield members. So if it's a generic medication, you can get it filled at Costco for free. If you go to like Rite Aid or any of that, you will have your copay amount, but Costco does offer the free generic, and it's generic only. And you don't have to have a membership. You can just tell them at the door that you're going to the pharmacy. Vita Health is another one. So that's personal health coaching. This is included with the Blue Shield membership through the district here. So there's one-on-one coaching, therapy, health trackers, all that different stuff. You have signups there. These 4 here are specifically for our Blue Shield PPO members. There is MAVR, which is a pregnancy and postpartum support. There is Carum Health, which is a hip, knee, and spine surgical specialist that's what they do. And so that's an option for you to look into them. There's virtual therapy through Hinge. They give you devices, and then you can do it at home instead of having to go in. And then there's also an enhanced cancer benefit that you're eligible to contact them for more support. There's just a few different things here with Blue Shield and Kaiser I want to mention. These 2 websites, or there's one for Blue Shield and a couple there for Kaiser. This is going to show you everything that you have available to you through the CISC. One of them, and I've highlighted here, is discounted gym membership. Through Blue Shield, you have to go through Fitness Your Way. Through Kaiser, you have to go through Active and Fit Direct. But with Kaiser, you also get the Calm app for free. And I do want to mention both of these offer out-of-state coverage for children away at college. If you have one of those kids and they don't have access to medical because they are out of state or out of the area, please contact me and I will help you get them set up. Okay, so here is our monthly cost chart. And some people have told me that this is a little confusing, so I'm just going to go over it pretty quick, briefly, and hopefully I think you can see my arrow, so where I'm pointing. Up along the top, we have what plan there is. So this is a PPO. Then you have, or the Blue Shield PPO, HMO 10, we have HMO 30, HMO Trio, and the HMO 15. Underneath each plan, so Blue Shield PPO has single, 2-party, and family. This top line right here where it says 100% and 8 hours, that is a full-time employee. So you can see along the top, that's what your cost would be. So the Blue Shield Trio, this is our least cost amount for families. Right now it was negotiated back down to 0, that the district is paying more. You can see Kaiser 15 is 122. So if you are 50% FTE, you only work 4 hours a day or 20 hours a week, you would be along the bottom line. And this is your monthly cost. We only do 10-month deductions. We do not deduct for June and July, but these are the monthly deductions. You can see it is quite a bit, but it is still offered and available to you for 50%. I know it can be quite a bit. 75%, that's what I am. I'm a 75% employee. I work 6 hours a day. So you can see along this line here is the amount that we pay. So like I currently have Trio. So I pay this $503.70 there per month for my medical. And honestly, we have really good insurance here because this is still cheaper, me at a part-time employee, than my husband who is a full-time under his company. It is cheaper here for us to be enrolled, and it is better coverage. I just want to mention too, single is just yourself. 2-party is you and any other one. It doesn't have to be a spouse. It can be you, spouse, you, and 1 child. Family is any 3 or more. Some of the other some other employers, like my husband's, does like employee and spouse and employee and this, but we don't do that. It's just single, 2-party, and family is any 3 or more. So you can see here too, I want to show you with the Kaiser, the HMO 15 is $122. Over here, the Kaiser 30 is $72. So it is a little bit less, still quite a bit Not as much of a drop as I guess we hoped, but it's still a little bit better option if you want to go with the $30 copay. You can see VSP has a breakdown here too. The VSP for Kaiser members, that's the $27. The district does not pay anything towards it. And then we have the same thing for dental, the PPO HMO. I'm running a little bit short on time here, so I'm going to go ahead and go over, and I'm going to pop up for questions here. Let me see if there's any questions.
Hi, Jenny. We don't have any questions right now.
Wow. Well, that's good. Hopefully I covered everything. We got about 5 minutes if anybody has any questions. Oh, I see something pop up.
Oh, we have one question. What is the difference between Blue Shield 30 and Blue Shield Trio?
Okay, so the difference between Blue Shield 30 and Trio is the network. So they have the same copays, same all of that stuff. The Trio has a little bit of a smaller network, but it still includes St. Jude, St. Joseph's. It includes a lot of the big ones around here. And we can look into that. I can show you the website too to look to see if your doctors are covered under that, because people don't want to do it because it's the cheapest plan. I'm on the Trio plan. It's a great plan. I love it. And I like having the cheaper insurance.
We have another question regarding life insurance. Is there a form we need to update that can be emailed?
Yes. And let me actually, with that, take you to the website, because I did forget to show you the website real quick here. So let me go ahead and take you over to that. Okay, so this here is our district website. How you're going to get to us is departments, human resources, and then right here at benefits. So this is our district website here. One thing I do want to mention, I mean, here it mentions that open enrollment has ended, but we do have this benefit drop box right here in the middle. So when you click on this, it's a secured drop box that you can upload documents to. We created this because that way people can share documents with us that have their socials and different things on that. It's a secure Dropbox, and it goes directly to myself and Andrea. We are the only two that have access to this. And then we print them and then delete them off. So you can see here on the website, we have all this information here. So life insurance, there is, if you just want to change your beneficiary, you can fill out this one, the beneficiary change request. If you want to fill out just a whole new form, which works also, is this one here. You do not have to fill out this top plan section. It's only employee section here. This one here, this is the supplemental if you wanted to apply for any supplemental. And then the lastly is you must have a signature on the last page. Let's see.
It looks like we don't have any other questions right now.
Okay, perfect.